So let me get back to, I'm not going to go backwards, so we're going to keep going from the current slide. So basically, here are the numbers in terms of the congregate care settings. And if you look at them, you know, it's interesting. Department of Mental Health has less than 5 now. Now, it's only once in a blue moon I mention the other settings because the numbers are so different. And in the beginning of the crisis, if you look at the number of clients that are recovered, they're a little over 10% in the Department of Mental Health. It looks like Mass Rehab Commission, which doesn't do a ton of residential stuff. There have been no cases reported. And I bet you that's because a lot of the living situations are individualized, you know, to the extent that they are, well, I guess that's not true. There could be some congregate settings, or they wouldn't be in the congregate setting situation, but it's 115 people versus DDS that has 7,741 people in the private system and 1,041 in the state operated system. But if you look at, you know, I talk about this off and on, we have about combined 25% recovery rate for the congregate settings. But if you look at the institution numbers, it's close to 40 to 45% that had the virus. So no deaths, it looks like, in the past week. And let me give you this. This is sort of, we finally have an updated number on deaths. Altogether, there have been 186 deaths across the DDS system, though. So that would include Hogan and Rentham facilities, right? And it would include the 8,000 something. Now, if you run the numbers on this, which I did, look at the bullet down there near the end. Deaths in our state. Population, it's at 0.25%. Ours is 4 times that rate. So when people release journal articles, right, that say we have multiple times the risk among people with disabilities, and most of the articles are focused on people with intellectual or developmental disabilities, right? Some of them are focused on Down syndrome, some on autism. The multiplier effect, you know, this sort of bears out, right? How much 2% versus 0.25%, okay? When you look at the death numbers. And so we finally have it, and I think it's really important to be aware of that, and that we're not just blowing smoke, you know, when we say the increased risk. So again, no deaths reported this week, but all in. And, you know, it's funny, about 6 weeks ago, I predicted we'd be at about 200 deaths across the board. And I was thinking just in the smaller congregate care system. But according to Department of Mental Services, I got the number last week. It's 186. So, you know, so it's, again, some people to memorialize. You know, you think about it's 186 people, 186 families. You know, it's something to think about of what we've all been through together. And this doesn't include staff deaths, by the way, which have happened as well, and family member deaths, right? In the United States, there's 33 million people with the virus, and some changed, 246,578 people. That's about an 80,000 growth since the last report. And deaths increased by 2,000. We haven't hit the 600,000 number yet, but I would bet we will before the pandemic's over. And North Dakota, Rhode Island, South Dakota, Utah, and Tennessee still lead the way. The states haven't changed at the top of the per capita virus rates. And then we looked at Massachusetts, we do that once in a while, we go back and forth, and our rate's lower than New York, but it's higher than Connecticut, Vermont, Maine, and then New Hampshire are doing the best in New England. So, and they're pretty far down there, Vermont and Maine. New Hampshire, not as far, but again, doing better than us in terms of the virus rates. So that's the recap on the COVID, and a couple of different pictures showing the world opening up. And again, there's still a debate on how much to open up. And this is a chart you can see on the web if you type in COVID rates by states. And obviously, they're doing a case rate per 100,000 people, and we're in good shape compared to some other states. And you see, if you're in the blue and dark blue, you know the rates are tougher. So I have Charlie Carr with me today, and Charlie, you remember this picture, I'm sure. He's you know, authentic disability rights pioneer. He truly is, because Charlie lived, I think, for a while down the street here. You know, I'm in Waltham in my office, even though you're seeing the skyline.
775 Chapello Road, Middlesex County Hospital.
Just minutes from me, you know, right from where I sit. Charlie wasn't something he asked for to be there, that's for sure. He's been a leader for over 40 years. In fact, he and I first worked together probably in the early 90s, you know, and when I came here, you know, I don't think we had worked together unless we did on the fights against those questions to cut funding. We might have, who knows, right? And that would have been in the 80s if we worked together then. He went on to start, by the way, he helped co-found the Boston Center for Independent Living in 1974. I did not know that fact. I knew you had been an independent living center pioneer, but I did not know you had founded Boston Center until I saw your bio. And it
was my only way out of Middlesex County Hospital, Leo.
Yeah. And of course, I should have realized it would have been Boston, right? And he went on to start the Northeast Independent Living Center and program in Lawrence, Mass. And that's how I got to know him, really, was at that point. And just very involved state and nationally. I know formally you were part of ADAPT or not. I know clearly you were part of Nickel and part of Silk, which are the state and national organizations around independent living centers. In 2007, he was appointed commissioner by Deval Patrick of the Massachusetts Rehab Commission. And so he's did that till 2015. So imagine, he was an advocate and both lived through it, advocating. And I think, was it Elmer Bartels played a role also in being in that?
Elmer gave me my first job, Leo, as a junior VR counselor.
Oh, wow.
Yeah.
For those of you who don't know, that's vocational rehab counselor, FYI. But yeah, go ahead. You were saying.
I'm just saying that I went from client to commissioner.
Right.
I made the circle.
Pretty cool. And basically now he's sort of, you know, advancing policy once again, like he did at Northeast Independent Living Center. And he's with the Disability Policy Consortium, a great organization that's been around for, I don't know, 30 years now, 25 years at least. And he's doing legislative liaison work. He's a consultant. He's an educator. He's all in, full integration. He's been wanting to close sheltered situations, segregated situations for decades. And now his emphasis is on youth engagement, empowerment, and the ADA generation, with the ADA generation. It's so important to have youth showing leadership, right? Developing leaders. And you know who does a good job in that too is the Mass DD Council. They have that program where I'll tell you, I've been to a few of the graduations because I knew people and they invited me. And I'm so impressed with the leadership development there. And I'm sure you guys are doing some wonderful stuff as well in terms of developing leaders for the future. So I'm really thrilled to have him with me. This is an old picture, Charlie. Bill's with you, and John Kerry. And I know the guy behind John. I can't remember his name. Who's that behind John?
I don't know. He was a camera guy, I think.
Oh, okay. So I saw him on, who knows, on media stuff. Okay. He looks familiar to me, the guy at his profile. But the guy in the middle, look how young he looks. Is that really you?
That's me. And we were at Fred Fay's house in Concord.
Oh, my God. Fred Fay. Okay. Yeah. And he's someone who would advocate. And he was, the time I met him, he was prone on a, what would you call that? You know, he was much of the time, right? He would be.
He was bedbound.
Bedbound.
He was doing a lot of connecting people via computer through a network, and was very instrumental in democratic politics. He worked on the Dukakis campaign. We were working here on the Kerry campaign. He was my idol, one of my mentors growing up.
But it shows what the possibilities are, doesn't it, Charlie? Because he was, you said bedbound. I remember meeting him, and he was prone, you know, on this, wasn't a bed, it had been transferred to some type of day bed or day, whatever you would call that, cot. And I said, wow, I'm impressed. I just needed to see that, and I knew how active he was through his communication. So it was like, oh my God, this is how you're doing it, you know? And so we take things so much for granted in life. And we also, what do you call it? Don't raise expectations enough, for each other and for people we know. So this is, Henning looks like he's a teenager there in the
I
picture.
know.
You both look very young. So
Kerry looks young too. Now his hair is all white.
right, no question. And I'm trying to remember first time I met him, he was running in the Capitol building and upset. He was supposed to meet with us and my board chair. And he said, hey, we said, hey, how you doing? It's so and so and so. And he goes, did they take good care of you in my office? That was his immediate thing. He said he's coming back from a hearing on the Vietnam vets, and we had just missed him because of something else. And anyway, so it's great to have you. We want to talk about the workforce crisis because Charlie brought that up recently. We were on something and we were talking about how tough it was, and he was talking about the PCA part of that and finding people. Carrie Mahoney just told me, who co-facilitates a lot with me, and she's our director of education outreach. She just told me about a family that she met where they had just interviewed or tried to interview 80 people to be PCAs in home support. 80. And of those 80, she's got 0 from the, and some don't even show up for the follow-up. So we want to talk about that, not just about DSPs and PCAs, but also frontline managers, nurses, others that we need in our field. But we also want to talk a little about housing. People were really into the housing session. We don't have to get deep into it, but it is interrelated, right? The cost of housing, it's never been so high, and it just continues to get higher. And that affects what people need to earn to have a living wage. So let's talk about a little bit about the workforce and what you're seeing, Charlie, in your section of the world.
Well, can we get rid of this?
Yeah, let me let me stop sharing.
I don't want to have to look at myself anymore.
No, I want them to see you anyway. I don't want them. Yeah, you're right. Go ahead.
So welcome everybody, and thank you, Leo. Leo, you've been a good friend over all these years, and one of the reasons why I really jumped at this opportunity is because, let's be honest, the disability community is fractured, and we don't talk to each other enough, and we're in our own little silos, and Dee doesn't talk to physical, and blind doesn't, it's so when we have issues that we can all come together on, that's a treat. But this treat is no treat. I have some data that I want to share with you around workforce, because look, it's a crisis. It is a crisis. We need to stop saying shortage. It's a crisis. And the example you just gave, Leo, of 80 people, and right. I go through, I wouldn't say 80, but 90% of the people I try to hire are no-shows. They don't even call. They don't, nothing. They just don't show up. But here's some of the data. From 2004 to 2014, the human service industry grew by 58% to 164,000 jobs. Now that's the broader industry. Now they're predicting from 2014 to 2024, an additional 25,000 jobs. So that means openings, not people. So this is huge, and we don't have a pool of applicants that we can rely on. So it's a crisis. And what are the reasons? Well, the reasons are many, but an annual salary of a healthcare worker is $33,100. That's it. Who can live in this audience on $33,100? Put food on the table, pay your rent or your mortgage, and everything else that comes. You can't do it. It's impossible. So it is a recipe for failure, and that's exactly what we're seeing. The other thing I'm thinking about the DD community for jobs is you're competing against state ops. You're competing against good state jobs that pay good money and have good benefits. So there's that going on. And then finally, what I'll throw into the cauldron is extended unemployment. So many people rightfully are on unemployment. They're making more now than they made when they were working. That's going to end in September. So Leo, I just wanted to throw that out to sort of start things off.
No, I think that's the reality. And let me ask you this, how was it before COVID out there in terms of, again, for people in independent living, looking for PCAs, I guess some people get home health, will use that when they're having trouble getting PCAs. So it's not as self-directed, right? The home health stuff.
It's home care workers, it's DDS, AFC, GAFC, all of that stuff, right? It's the whole broad spectrum. Prior to COVID, it was getting really, really hard. COVID hit, it was ridiculously impossible. And now post-COVID is kind of what I was describing,
Yeah.
which is that there's this dearth of good people out there that don't even show up.
Right. And one of the things in relation to our world, and I appreciate you making the state op comparison, but we also compete with schools, with hospital settings, all of us, regardless of which sector, and we really, and you brought up the point of the fractured aspect of it. From our perspective, that really shouldn't be but it happens because we're all busy and we're all like get into our tunnel. And we have a state agency to react to, right? Or it might be a line item we want to react to. I would say we do our best work when we were looking at the bigger issues, the healthcare and housing. Last week we had, talking about the housing, we had a presentation through Affordable Housing Group, which I was glad to hear was new because I had not heard of them before. And they're really been developed. And Chris Kana from SIL had introduced me to them. But basically they're around affordability is the key issue, though they're also talking about accessibility. The average, I'd say the fair market rent for a 2-bedroom, and I think this is probably low, is close to $2,000 a month. You were talking about how can people afford. So $2,000 a month, 2 bedrooms, assuming you have you're a family, right? That's $24,000 a year. That's just for the fair market rent, right? So probably 2 of you are working. One of you probably has a second job. And who's watching the kids? How much does childcare, you get into that piece of it as well. So then the question is, are our jobs the same as hotel jobs? Are our jobs the same as working at Dunkin' Donuts? Right now, all these sectors are having trouble hiring, right? I would argue our jobs are different. Our jobs are an extension of government investment or government, what would you call it, responsibility in terms of helping people live their lives. And so it's a different category than a hotel being worried about having enough workers, right? I want them to have enough workers. Don't get me wrong. I'm not knocking hotels, but I think in our space, the fact that I don't know what the average salary now is for PCAs. It's around $16 an hour.
$15.75.
Okay.
Sounds like a lot, but there are virtually no benefits with that.
Okay. So what's really interesting about that is, how they do rate setting, right, for the programs, and for the public. I really want people to understand that the process of getting the wages up, we had a little bit of victory last year before COVID hit. We were able to get a 10% increase for the rate for people in residential services through the purchase of care, the private provider piece. And we were only able to do that with concerted advocacy and support from legislators.
We lost you, Leo. You're
okay. I think I'm back. Okay. So the rate process, what happens with rates is the salaries are embedded in a rate that's given to an agency. They identify base salaries. You were telling me PCA is $15.75.
Yeah.
The blended rate, now this is blended, which means if you've worked for an agency 1 year or you've worked 7 years, was $15.53 for the day program, community-based day supports and employment services. Think about that for a second. These are people that are either helping people get jobs or they're helping people connect to companies, right? Or they're helping people go out and get engaged in the community since the sheltered workshops, right, have closed. We're trying to get people included in everyday life. And the base blended salary, not the entry-level salary, is projected at 1553 to make a year rate for the year of 2022.
Can you hear me, Leo?
Yes.
Oh, okay, I thought I was unmuted. Sorry. Can I circle back to worker shortages for a minute?
Yeah.
I just want to share with everybody, what can we do? And one thing that we can do is, and I know that ArcMass and some other groups have already weighed in on this, but we got $400 million in American Rescue Plan money for 8 home community-based services. And I think the very first priority needs to be a bonus for workers that leads to permanent increase in rates, because you were talking about rates, and this would be a great way, because that's a 10-year glide path for that money. So we could do some work if we could just get a decent amount of money into rates.
Yeah. No, that's something we could work on concertedly together, right? Instead of separately. Rosalie just wrote in a chat, she said she was on a call with some day service providers, and they've raised their entry-level rates to $17.50, even though the rate for those positions that is being allowed is $15.53 in terms of filling out the formula. I don't know if you have a magic number in mind. When we started advocacy a couple of years ago, we were saying $17 an hour at that time, just to start, for the starting salary. Obviously now we're more like $18, $19 an hour. We're thinking as a minimum starting salary. We'd love to see the salaries eventually get to $22 to $24 an hour, because these jobs, we want people that we can depend on, PCAs, maybe they could start at similar salary, but eventually if you have someone on board for a number of years who you can count on, it's probably more cost effective too, right? Because
you've got to look at the skill sets required, all right? In this work, it's not the same as an ice cream scooper or somebody waiting tables or, somebody cleaning hotel rooms. This is very difficult work.
Now, let me ask you this about DPC. Are they hearing from young people who are transitioning to adult life, finding barriers at the present time because of the post-COVID environment? Because we're hearing that a lot from people transition age.
I wouldn't say that it's a huge number, Leo, but there are some people that are in that age. We do disability history training and stuff in the Malden school system prior to COVID, and we're looking to branch out. But in general, it's not easy to be a young adult and then decide to go from that setting, with mom and dad maybe, to some level of independent living.
We have it. We actually do statistics. Of course, statistics are misleading because these are individuals, young adults of all capabilities and levels of needing support. We have somewhere between 12 and 1,300 graduating at 22 or earlier. Yeah, every year, Charlie. Now, of those, we know everyone doesn't get funding, maybe, and there's people, by the way, that aren't numbered, right? Who basically are not falling through the cracks. They're just living their lives, right? They've gotten the education they need. Maybe they have a job already. Or they just don't call on DDS. They just go on with their lives. And of those 1,300, I'm sure there's a certain number, right, that fall in that category. But we know over 200 are like an immediate need for residential stuff, residential support. And we've been trying to see more shared, but not shared living. That's fine. I have shared living. I'm a big proponent of supported living and self-direction services, as I would think you would be. And what I find is people often get barriers to doing that, right? And they're discouraged by the staff sometimes that they meet at the area offices because they're thinking, well, we'll find you a home to live in. But even that right now, the homes, people can't take in people that are presenting, need more staff due to medical reasons or behavioral reasons. So that's what we're finding. Ann just wrote, CNAs are $16 to $19.
Wow, that's going up.
Yeah, and that's probably, I think the crisis in the nursing homes, right, would have precipitated that. How many deaths? We had a bad month.
you looked at the statistics earlier. The fact of the matter is the majority per person per capita is in nursing homes nationally, the number of deaths.
Right, right. So ours might be at 2%, but theirs was probably significantly higher, you know? I can tell you at Hogan, for example, people who caught the virus, not necessarily deaths, was at somewhere around 60% of the people living at that state facility.
But so anyway, we need to get that home and community-based service money online in people's pockets, provide some training as well, because training is critical. And that's 7 to 10 years worth of money. And then all of us can come together and work on getting those rates up to the level you're talking about.
Yeah, so they announced last Tuesday wanting to put out 100 million in phase one of the 400 something million. And 90% of that would be for frontline. And I don't know about you, I think they could make it annualized, because as long as they're willing to make the long-term, because the first 50 cents is free right now for the state, correct? Because they're getting this extra grant.
No, and after the FMAP bump, you get an extra 10%. So it's more like 40 cents.
Good point. Right.
So,
yeah.
Go ahead.
I was going to say, or you use that for your 50 cents at first, right? So it's free for you, raising the salary. And then a year from now, okay, you got to come up with 50 cents, or 2 years from now, whenever that is, depending on how you're allowed to use this money through 2024. Okay. But we'd rather use more early, I think, is where we're at, because of the significant need, correct?
So Leo, where do you think people in the audience, what do you think people in the audience could do to make a difference, to make sure that what we're talking about actually happens?
I think there's one thing they could do right away is make sure their senator and House member knows how essential this is.
And does ArcMass have a position paper they can share?
We actually have a statement on the workforce. I should pop it in right here. And we also have a workforce paper that's from 2018, if people want to get more details. And we also have an action center that allows texting as well. But we should put in the statement, actually, Charlie. That's a great point. We should, let me.
Because while you've got 20-something people here,
right,
half of you or maybe more to drop a note, that makes a huge difference. We need this money in our pockets. I don't think anyone would argue that.
And the other question is, how are we going to long-term in terms of working together, different groups coming together? Because, I think we clearly have stuff in Mass Health too. I mean, the PCA programs in Mass Health. We have a lot of our services at a state agency, Department of Developmental Service. I'm going to drop in the statement, folks, so you guys will see it about the workforce. But I think, that's interesting. It's not going in. Okay. That's really strange. All right. Let me hit paste. There you go. Yeah, it's not going. I'll try to copy it again. In terms of, let me ask you this. I do want to talk a little bit about the housing piece for a few minutes. But first place, as Charlie said, we really need to start working together to make sure the word gets out. And on the DPC piece, is this your number one issue at DPC? What else are you guys focused on and looking at?
We're focused on a few things, Leo. This is our number one piece. We also want to have Mass Health do a cash and counseling program in the PCA program, so that we can, you know how that works, cash and counseling, right? DDS.
Why don't you tell some people about it, just so they know?
So the idea is within the PCA program, you get X number of hours that you can, hire somebody to work. But the problem is the rate is $15.75. Let's say you need somebody to come into your house at 3 o'clock in the morning for an hour and a half. Who do you know is going to do that for $15.75 an hour? So what cash and counseling does is it sets up like a little budget, and you can spend $30 on that visit, that that week, that day of the week. You know, you've got a cap, and it's not just free money, it's still within your budget, but it gives a lot of flexibility. So we're working a lot on that one.
So and how would you get that through?
It would be a 1915 CJ waiver.
Gotcha. Oh, state plan waiver.
Yes.
Okay, so what Charlie, so what's exciting, our state has not, for whatever reason, right, gone after these state plan waivers. In fact, we were advocating for K, which stood for the Personal Assistance Program. I think it was called Community First Choice when Judy Bigby was secretary.
Yeah.
And Governor Patrick. And we got nowhere because they had a new design for what was called One Care. And all the energy was going into One Care, right? And what I want people to know is that program would have allowed people who needed prompting and cueing, but not, and that would have been good for people physically disabled too, because it would have given you much more of a breath.
Yeah, but people with psychiatric disabilities, I mean,
right.
The gamut, Leo.
Yeah, it was really disappointing that we couldn't get traction on that, and that's, you know, we win some, we lose some, but that was a tough one. We can't afford to lose the workforce piece, and I do think I want to bring up housing because I do think if we don't work together around the cost of housing, I think we also face a problem because we're not. To me, you know, and you react to this, Charlie, I think there's 4 things we have to do to deal with the workforce. One is just what you said originally. Number 1 priority, let's get some money in there because we're in a terrible crisis, okay? And I'd argue we were in a crisis before COVID. It's just now it's like unbearable because people that are just graduating can't even get into a home or can't get into a day program. So now they're like 24/7. If they're semi-independent, they're like frustrated being home with mom and dad or doing nothing. If they need more assistance or support, their family members are providing that 24/7, you know, and maybe not so well sometimes because every family's not created equal.
What do we call that, Leo? Natural supports?
Natural supports, Charlie,
Yeah.
right? They don't always work.
We go back a long time with natural support.
I know, right? Exactly. And so that's number 1. Number 2 is better use of technology for independence, for people to communicate. So there's behavioral issues that happen because people can't say they're in pain. They can't say, I don't really want to do this. Can we do this? So after just imagine if you had weeks and weeks of people not listening to you, forget the pain part of it. Just you couldn't do what you wanted. You would probably get pissed off and start hitting people after a while, you know, and people sort of sometimes disagree with me when I get into this about the additional staffing that's assigned to programs. But now one more person's got to know me, you know, how many people are going to take the time to get to know me? The third piece is the how costs. If things did not cost, if Massachusetts was not the 3rd most expensive place to live, right? We would not have to pay as much. You know, well, guess what? We're not paying as much. We're paying as if we live in Mississippi. No, we live in Massachusetts, and the salaries have got to reflect that. So, but if we don't do this together, people aren't going to hear us. So we've reached out to the Globe. We're hoping they'll do a story on the crisis now that people can't even get back to the day programs. Their employment's been a little better than the day programs, right? Because some businesses are responding. But it's really a serious.
Leo, on the housing,
yeah.
Let me just throw out something real quick. The Disability Policy Consortium with BCIL has been working with the legislature for about 5 years on the alternative housing voucher program. We got a huge hit for the last 2 years. So if you're a person with a disability under the age of 60, Department of Housing and Community Development has vouchers burning a hole in their pocket. So if you fall within that under 60, have a disability, you're eligible for an AHVP waiver that covers 80% of the local median income, which is how they determine your rent. So 80%, that's massive.
That's great. That's more than historically. I just put that in the chat so people can get that out. That's excellent.
Yeah, and then the other subsidies are the Section 8, which I'm sure everybody knows about. But the mass rental voucher program is another one that is a little better in terms of percentage of payment, 50% of the area median income. You know what the state's general area median income is?
No, tell us.
It's where I had it, $85,483.
Wow.
Who and a human service worker earns $33,100 annually. I mean, it's impossible.
Right, right. Wow. And this is what I think the average person doesn't understand. I got a feeling more and more people, what I can't understand, like police, fire department, right? Teachers, they must struggle with these issues. You know, they're getting paid that better than they were in the past, but why don't we have a full community working on this affordable housing issue and accessible housing, obviously, that's got to happen. And I think that's something that if we don't solve the housing costs, the housing values, last week, the key focus was on local zoning laws, Charlie, and doing something about those, including accessory apartments. And we have a bill in play for accessory apartments that would serve both people with disabilities and elders. And
Was that CFI or?
So what that would do, it's
Corporation for Independent Living, or?
well, actually, the group that was on last week was the Corporation for Independent Living, Christian, and Abundant Housing, which is a brand new.
We're working with them, Leo, to help design smaller homes for veterans.
Wow.
With this money that came through for veterans.
Yep.
They're going to help us develop smaller sort of group home type models for veterans.
That's great. Wow, I didn't know that. That's awesome. Across the state?
Yeah.
Great. And are you at the early stages of that, or?
We're just in the discussion stages.
Okay, cool. Yeah, so, I mean, there's a lot of work we have ahead of us. Anybody want to ask Charlie a question or me a question or participate in the conversation? You can chat or come on. We have a few minutes left. We'd love to have some reactions.
Don't be shy.
Yeah.
You've got a wealth of information here between the two of us. Just anything goes.
Hi, this is Ann Allen. Leo, you said something about behavioral. Is it supposed to be like higher risk or?
So what's happened, what I was trying to say is folks with behavioral conditions and needing additional supports, they're finding it's additional barriers to getting served post-COVID because of the lack of staff. And some organizations are actually saying, I want to serve your son, I want to serve your daughter, especially if they're new. They have to just wait, you know, and the only way to get around that, honestly, is to say, you know what, I want to set up my own self-directed program for myself or for my son or my daughter, because then you can at least get the ball rolling. And I would go up the food chain if people rejected that. We do know people.
Is that a waiver program?
It is, and it's well, you know, I'd say 90% of DDS is 50. You know, it's totally federally funded through waivers, 3 waivers, and actually it's more than 3 waivers, but 3 adult waivers. And and those rules, they just changed them around technology. We did something on that recently where we really believe technology can make a huge difference in our world, and it does, of course, with people with physical disabilities. It's been making a change for 20 years, 30 years.
Leo, you could go online and look at the different submissions on the RFI.
Yeah.
I noticed a lot of requests for technology.
Yeah, and it makes sense, doesn't it? Technology and infrastructure. So we actually just had a meeting with folks connected to MIT, and we're pretty excited. That was Friday afternoon, and I'm planning to communicate with the state around some strategies, because we have a report called Technology Forward, where we had a task force with DDS and the Trade Association, ADDP, but a lot of the results can apply cross disability. I mean, and again, cross disability, there's been more technology, you know, than in our world for a variety of reasons. But I think it's because people with cerebral palsy and the sort of physical conditions knew what a difference it could make and advocated for those things. And that's what it's about, Charlie, right? If you don't ask, you're not going to get it, right?
We have to look for common ground, and this is one. Assistive technology in general cuts across everything.
Yeah.
You know, even old people like us, Leo, you know, even though you can't use the damn share the screen, you're pretty technological.
It's funny. I can't even remember the first time we met, but one day we went to visit a workshop together because Charlie was like, let's get them all closed, So of course, and it was the wage issue too. Remember, I was talking about people said,
I
okay.
think you came up to my place. We went through Art, what's his name's place?
Oh yeah, Art Brady.
Yeah.
And then we went into Boston to see the workshop there. What was it called? It was in downtown.
Yeah, I forget. I know the one you mean.
Yeah.
I was shocked.
Yeah.
I
No,
was
it is shot. I mean, honestly, there's a few left, but in most cases, the workshops, I mean, the problem with the workshops was twofold, but the biggest problem was it's hard to run two systems at once, right? If you're trying to help people be included, and yet at the same time, you're investing time and, staff in something that's separate, substantially separate, it's really hard. You can't really do both.
I don't know if the politics are right, but I like what Jim Cassetta does a lot, the enclave work. There are good jobs out there, and we just need to figure out how to get them.
And for some people, enclaves better than others, right? And for other people, they want to do their thing. They want to be in it.
Yeah, I know, right.
Right. So anyway, folks, any last things? Because we hit 12:45. I can't believe it. It went fast. We have a lot of work ahead of us. Charlie, this has been a pleasure. We're going to have to do it down the road again, maybe invite a couple of old friends on, and but we really can do a lot together. Oh, something just came up on the chat before we let people go. Oh, Anne's saying thank you. Yeah, happy to do it. And I can't tell you how much I respect Charlie, and really can't believe it's been this many years, and
the feelings are mutual, Leo. And before people jump off, let's get that work statement to them and call your legislators and say, we need this ARPA money in our pockets right now. We're desperate.
Sounds good. And I gave people the link to the action page. For some reason, it won't let me paste the statement, but we'll send it out with the PowerPoint PDF. And I want to thank Charlie for being on with us. Everybody, hope you have a great, awesome week. And we'll be on next week. It's Mary, someone from, is it Fidelity or Able Accounts? Carrie?
Yes, so we have Mary Rubinis from MIFA, and she's going to be talking to us about Able. And I just wanted to also let people know, I just arranged it this morning, but Joanne Pino from Mass Advocates for Children is going to be talking about compensatory services during COVID and what you still can do. And that's on June 29th at noon. So that will be going out shortly.
So that's a Tuesday, right? That's a special webinar?
Yep.
Okay. And on the 28th, the day before on Leo Live, we're going to have, I think the ARC of the South Shore talking about autism support services. And we'll get into some more policy stuff in July. July 4th, we will not, or July 5th, whatever it is, we will not have a Leo Live. So thanks, everybody. Have a great week. Charlie, thank you again. Great seeing you, buddy. Bye-bye.
Bye-bye.
Bye.